How to use Piroxicam correctly, dosing science you can't ignore. Welcome back to the channel. Today, we're diving deep into how to use Piroxicam correctly, a powerful medication used to relieve arthritis pain. If you or a loved one is prescribed Piroxicam, understanding how to take it safely and effectively is crucial. Let's break it down. What is Piroxicam? Piroxicam, often known by its brand name Feldene, is a nonsteroidal anti-inflammatory drug, NSAID. It's designed to reduce inflammation, joint pain, swelling, and stiffness, especially in conditions like osteoarthritis and rheumatoid arthritis. You take Piroxicam as a capsule, usually just once a day. Its long half-life means it works steadily throughout the day to ease your symptoms. Why take Piroxicam? If you're dealing with chronic joint pain from arthritis, Piroxicam can be a game-changer. Clinical studies show it helps reduce joint inflammation and improves mobility by blocking enzymes called COX-1 and COX-2, the culprits behind pain and swelling. How to take Piroxicam correctly? Here's the key to using Piroxicam safely. Take it with food or milk. This simple step helps protect your stomach lining. NSAIDs, including Piroxicam, can irritate your stomach and cause side effects like nausea, vomiting, or even ulcers. Avoid alcohol while on Piroxicam. Combining alcohol and NSAIDs increases the risk of serious stomach bleeding. Don't combine Piroxicam with other NSAIDs such as ibuprofen or naproxen. This can dangerously increase your risk of stomach problems and bleeding. Tell your healthcare provider about all other medications you take, especially blood pressure drugs and blood thinners like aspirin. Piroxicam can interact with these and affect how well they work or increase side effects. Common side effects to watch for. Like any medication, Piroxicam can cause side effects. Most people tolerate it well, but you might experience nausea or stomach pain, diarrhea or constipation, headaches or dizziness, rash or swelling, ringing in the ears. If you notice vision problems, like blurred vision or eye pain, contact your doctor immediately. This is rare but important to catch early. Proper dosage for adults. For most adults, the usual dose for osteoarthritis and rheumatoid arthritis is 20 mg once daily by mouth. Some patients may take 10 mg twice a day if recommended by their doctor. It's important to start at the lowest effective dose and only take Piroxicam for the shortest duration necessary to control symptoms. This minimizes side effects and complications. For older adults, doctors generally recommend starting at the lower end of the dosing range because the risk of side effects can increase with age. Key points on using Piroxicam safely. Always weigh the potential benefits and risks of Piroxicam with your healthcare provider before starting it. There may be other therapeutic options better suited for you. Your dose and frequency might be adjusted based on your individual response after starting treatment. Never change your dose without consulting your doctor. Taking Piroxicam with food or milk can reduce stomach upset, a common side effect of NSAIDs. What to avoid when taking Piroxicam? Avoid alcohol to reduce your risk of stomach bleeding and ulcers. Don't use other NSAIDs like ibuprofen or naproxen simultaneously unless your doctor says so. This combination raises the risk of serious stomach problems. Inform your healthcare provider about all medications you're taking, especially blood pressure medicines and blood thinners like aspirin, since Piroxicam can interact with these drugs. Important precautions. If you have an allergy to aspirin, you might also react to Piroxicam. Always disclose your allergies to your healthcare provider. Store your medication out of reach of children and pets. Accidental ingestion can be dangerous. If this happens, call poison control immediately. Piroxicam can be a highly effective tool to manage arthritis pain, but using it correctly is essential for your safety and health. Follow your doctor's instructions closely, avoid mixing with other NSAIDs or alcohol, and always keep an open line of communication with your healthcare provider about your medications and side effects. If this helped you understand how to use Piroxicam correctly, please like and subscribe for more health insights. Got questions? Drop them below. Thanks for watching. Stay healthy and informed.